Welcome to Path to Nursing. Let's practice 30 NCLEX-style questions with detailed rationales. Let's begin. Question 1. A nurse is assessing a client at 39 weeks gestation who reports contractions every 5 minutes. Which finding is the best indicator that the client is in true labor? A. Contractions stop with walking. B. Cervical dilation and effacement are progressing. C. The client reports lower back discomfort only. D. Contractions are irregular. Correct answer, B. Cervical dilation and effacement are progressing. Rationale: progressive cervical dilation and effacement confirm true labor. False labor contractions do not result in cervical change. Question 2. The nurse is assessing a client in the first stage of labor. Which finding is expected? A. Delivery of the placenta. B. Complete cervical dilation. C. Progressive cervical dilation from 0 to 10 centimeters. D. Birth of the newborn. Correct answer, C. Progressive cervical dilation from 0 to 10 centimeters. Rationale: the first stage of labor begins with the onset of true labor and ends when the cervix is fully dilated to 10 centimeters. Question 3. A client asks what effacement means. Which response by the nurse is most accurate? A. It is the opening of the cervix. B. It is the thinning and shortening of the cervix. C. It is the baby's descent through the birth canal. D. It is the rupture of the amniotic sac. Correct answer, B. It is the thinning and shortening of the cervix. Rationale: effacement refers to the thinning and shortening of the cervix in preparation for birth. Question 4. A client is 8 centimeters dilated. Which phase of the first stage of labor is the client most likely experiencing? A. Latent phase. B. Active phase. C. Transition phase. D. Fourth stage. Correct answer, C. Transition phase. Rationale: the transition phase is the final part of the first stage of labor and generally occurs from about 8 to 10 centimeters dilation. Question 5. The nurse identifies that a client has reached the second stage of labor. Which event occurs during this stage? A. Delivery of the placenta. B. Cervical dilation from 0 to 10 centimeters. C. Birth of the baby. D. Maternal recovery. Correct answer, C. Birth of the baby. Rationale: the second stage begins at complete cervical dilation and ends with the birth of the newborn. Question 6. A laboring client reports an urge to push. What should the nurse assess first? A. Maternal temperature. B. Cervical dilation. C. Blood glucose level. D. Urine output. Correct answer, B. Cervical dilation. Rationale: the nurse should confirm complete cervical dilation before encouraging pushing to prevent cervical injury. Question 7. Which finding indicates that the client has entered the third stage of labor? A. Regular contractions begin. B. The placenta is delivered. C. The cervix reaches 10 centimeters dilation. D. The client begins pushing. Correct answer, B. The placenta is delivered. Rationale: the third stage of labor extends from the birth of the baby until the placenta is expelled. Question 8. A client asks about fetal station. Which explanation is correct? A. It describes the baby's heart rate. B. It indicates the baby's position relative to the mother's ischial spines. C. It measures cervical dilation. D. It determines the baby's weight. Correct answer, B. It indicates the baby's position relative to the mother's ischial spines. Rationale: fetal station describes how far the presenting part has descended into the maternal pelvis. Question 9. During labor, the nurse observes contractions occurring every 2 to 3 minutes, lasting 60 to 90 seconds, and increasing in intensity. What is the nurse's best interpretation? A. False labor. B. True labor. C. Braxton-Hicks contractions. D. Uterine rupture. Correct answer, B. True labor. Rationale: regular, increasingly strong contractions with progressive cervical change are characteristic of true labor. Question 10, Bonus Sata. A nurse is teaching a pregnant client about the signs of true labor. Which findings should the nurse include? Select all that apply. A. Regular contractions that become stronger over time. B. Progressive cervical dilation and effacement. C. Contractions that stop with walking. D. Increasing frequency of contractions. E. Pain relieved by rest and hydration. Correct answers, A, B, D. Rationale. A. True labor contractions become stronger, longer, and closer together. B. Cervical dilation and effacement are the hallmark signs of true labor. C. Contractions that stop with walking are more typical of false labor. D. In true labor, contractions become more frequent over time. E. Pain relieved by rest or hydration suggests false labor rather than true labor. Question 11. A client is receiving an oxytocin infusion for labor induction. The nurse notes contractions occurring every 1 minute, lasting 90 to 100 seconds. What is the nurse's priority action? A. Increase the oxytocin infusion. B. Stop the oxytocin infusion. C. Encourage the client to push. D. Continue monitoring the client. Correct answer, B. Stop the oxytocin infusion. Rationale. Contractions occurring too frequently, uterine tachysystole, can reduce blood flow and oxygen to the fetus. The priority nursing intervention is to discontinue oxytocin immediately to reduce uterine stimulation. Question 12. A laboring client experiences spontaneous rupture of membranes, RUM. Which assessment should the nurse perform first? A. Assess the fetal heart rate. B. Measure maternal blood pressure. C. Encourage the client to walk. D. Assess pain level. Correct answer, A. Assess the fetal heart rate. Rationale. After RUM, the priority is to assess the fetal heart rate because umbilical cord prolapse can occur and may cause fetal hypoxia. Question 13. Which maternal position promotes the best uteroplacental blood flow during labor? A. Supine. B. Left lateral. C. Lithotomy. D. Prone. Correct answer, B. Left lateral. Rationale. The left lateral position prevents compression of the inferior vena cava, improving placental perfusion and fetal oxygenation. Question 14. A nurse teaches a client breathing techniques during labor. What is the primary purpose of these techniques? A. To eliminate labor pain completely. B. To promote relaxation and improve coping. C. To shorten the first stage of labor. D. To increase contraction strength. Correct answer, B. To promote relaxation and improve coping. Rationale. Breathing techniques help reduce anxiety, improve maternal coping, and enhance relaxation during labor. Question 15. The nurse observes green-colored amniotic fluid after rupture of membranes. What is the nurse's priority action? A. Document the finding only. B. Continue routine care. C. Notify the healthcare provider and monitor the fetus closely. D. Encourage ambulation. Correct answer, C. Notify the healthcare provider and monitor the fetus closely. Rationale. Green or meconium-stained amniotic fluid may indicate fetal stress. The fetus should be monitored closely for signs of distress. Question 16. A nurse is caring for a client with an epidural. Which nursing assessment is the highest priority? A. Blood pressure. B. Temperature. C. Weight. D. Vision. Correct answer, A. Blood pressure. Rationale. Epidural anesthesia may cause maternal hypotension, which can decrease uteroplacental perfusion. Frequent blood pressure monitoring is essential. Question 17. A laboring client reports a strong urge to push. What should the nurse assess before encouraging pushing? A. Cervical dilation. B. Maternal temperature. C. Blood glucose. D. Urine output. Correct answer, A. Cervical dilation. Rationale. The cervix must be completely dilated, 10 centimeters, before pushing begins to prevent cervical injury and swelling. Question 18. A client receiving oxytocin develops recurrent late decelerations on the fetal monitor. Which intervention should the nurse perform in addition to stopping the oxytocin infusion? A. Place the client in the left lateral position. B. Encourage pushing. C. Increase the oxytocin rate. D. Place the client in a supine position. Correct answer, A. Place the client in the left lateral position. Rationale. Stopping oxytocin and repositioning the client help improve uteroplacental blood flow and fetal oxygenation. Question 19. Which nursing intervention best promotes labor progress and maternal comfort? A. Encourage frequent position changes. B. Keep the client flat in bed. C. Restrict oral fluids unless contraindicated. D. Discourage walking when appropriate. Correct answer, A. Encourage frequent position changes. Rationale. Changing positions can improve comfort, enhance fetal descent, and support effective labor. Question 20, Bonus Sata. A nurse is caring for a client during active labor. Which nursing interventions are appropriate? Select all that apply. A. Monitor the fetal heart rate regularly. B. Encourage position changes. C. Assess contraction frequency, duration, and intensity. D. Place the client in the supine position for comfort. E. Provide emotional support and reassurance. Correct answers, A, B, C, E. Rationale. A. Continuous or intermittent fetal heart rate monitoring helps assess fetal well-being. B. Position changes improve maternal comfort and may enhance labor progress. C. Contractions should be assessed regularly to evaluate labor progression and identify complications. D. The supine position may compress major blood vessels, reducing blood flow to the uterus and fetus. E. Emotional support reduces anxiety and improves the labor experience. Question 21. A nurse is caring for a laboring client when the fetal heart rate suddenly drops to 70 beats/min after the membrane's rupture. Upon examination, the nurse sees the umbilical cord protruding from the vagina. What is the nurse's priority action? A. Apply fundal pressure. B. Insert a gloved hand to relieve pressure on the cord while calling for help. C. Push the cord back into the uterus. D. Encourage the client to push. Correct answer, B. Insert a gloved hand to relieve pressure on the cord while calling for help. Rationale. Umbilical cord prolapse is a life-threatening obstetric emergency. The nurse should relieve pressure on the cord to improve fetal oxygenation while summoning assistance and preparing for an emergency cesarean birth. Question 22. A client experiences shoulder dystocia during delivery. Which nursing action is anticipated first? A. Apply fundal pressure. B. Assist with the McRoberts maneuver. C. Pull firmly on the infant's head. D. Place the client in the supine position. Correct answer, B. Assist with the McRoberts maneuver. Rationale. The McRoberts maneuver, hyperflexing the mother's legs toward her abdomen, is the first-line intervention for shoulder dystocia because it increases the pelvic outlet. Question 23. Which assessment finding suggests uterine rupture during labor? A. Sudden severe abdominal pain with fetal heart rate abnormalities. B. Mild lower back pain. C. Regular contractions with moderate pain. D. Bloody show. Correct answer, A. Sudden severe abdominal pain with fetal heart rate abnormalities. Rationale. Uterine rupture is an obstetric emergency characterized by sudden abdominal pain, abnormal fetal heart rate patterns, loss of fetal station, and possible maternal hemorrhage. Question 24. A client at 36 weeks gestation presents with bright red, painless vaginal bleeding. Which condition should the nurse suspect? A. Placenta previa. B. Placental abruption. C. Uterine rupture. D. Ectopic pregnancy. Correct answer, A. Placenta previa. Rationale. Placenta previa classically presents with painless, bright red vaginal bleeding during the second half of pregnancy. Question 25. A pregnant client reports sudden, painful vaginal bleeding and severe abdominal pain. Which complication is most likely? A. Placenta previa. B. Placental abruption. C. False labor. D. Hyperemesis gravidarum. Correct answer, B. Placental abruption. Rationale. Placental abruption causes painful vaginal bleeding, uterine tenderness, and can lead to fetal distress due to premature separation of the placenta. Question 26. A nurse observes meconium-stained amniotic fluid during labor. Why is this finding concerning? A. It may indicate fetal distress. B. It confirms placental abruption. C. It indicates maternal infection. D. It is always a normal finding. Correct answer, A. It may indicate fetal distress. Rationale. Meconium-stained fluid may occur when the fetus experiences stress or hypoxia and requires close fetal monitoring. Question 27. Immediately after delivery, a client has heavy vaginal bleeding and a boggy uterus. What should the nurse do first? A. Massage the uterine fundus. B. Call the family. C. Encourage ambulation. D. Place the client in Trendelenburg position. Correct answer, A. Massage the uterine fundus. Rationale. A boggy uterus suggests uterine atony, the most common cause of postpartum hemorrhage. Fundal massage helps stimulate uterine contraction and reduce bleeding. Question 28. A client receiving oxytocin develops uterine tachysystole, more than 5 contractions in 10 minutes. What is the nurse's priority intervention? A. Stop the oxytocin infusion. B. Increase the oxytocin rate. C. Encourage the client to push. D. Continue monitoring only. Correct answer, A. Stop the oxytocin infusion. Rationale. Stopping oxytocin helps reduce excessive uterine contractions and improves fetal oxygenation. Question 29. A laboring client suddenly develops shortness of breath, chest pain, hypotension, and cyanosis. Which emergency complication should the nurse suspect? A. Amniotic fluid embolism. B. Placenta previa. C. Hyperemesis gravidarum. D. Gestational diabetes. Correct answer, A. Amniotic fluid embolism. Rationale. Amniotic fluid embolism is a rare but life-threatening emergency that presents with sudden respiratory distress, cardiovascular collapse, and disseminated intravascular coagulation, DIC. Question 30, Bonus Sata. A nurse is caring for a laboring client experiencing recurrent late decelerations and suspected fetal distress. Which nursing interventions are appropriate? Select all that apply. A. Reposition the client to the left lateral position. B. Discontinue the oxytocin infusion if it is running. C. Administer oxygen as prescribed. D. Place the client in the supine position. E. Notify the healthcare provider and prepare for possible emergency delivery. Correct answers: A, B, C, E. Rationale. A. Left lateral positioning improves uteroplacental blood flow and fetal oxygenation. B. Stopping oxytocin reduces excessive uterine contractions that may contribute to fetal hypoxia. C. Supplemental oxygen may be administered as prescribed to improve maternal oxygenation. D. The supine position can decrease uteroplacental perfusion by compressing major blood vessels. E. Persistent fetal distress requires prompt notification of the healthcare provider and preparation for possible emergency intervention. Notification bell so you never miss a new NCLEX practice session.